Welcome to St. Agnes Provider Order Management. In this session, we are going to review medication orders, ordering IV fluids and rates, ordering IV medications, ordering oral medications, and editing medication orders. Allergy information is always displayed in the patient demographic bar. Allergies must be recorded before any medication can be entered. If allergy information has not been entered, you will see this warning when you first select orders. Click on the blue eye to record or edit allergies. Use these buttons to enter, edit, or delete allergies. To enter a new allergy, select Enter New. Do a type-ahead search by typing the first few letters of the allergen. Do not use abbreviations. Then select the item using your mouse. Specify as much information as you can about this allergy, including severity if known and type of reaction. This will assist you and other providers in assessing allergy cross-checking. Then select the Save button located in the footer. Repeat this process to enter more allergies, then select the Save button. To delete an allergy, use your mouse to highlight the item and then select Delete. To order individual medications, use these buttons to select Meds and Name. We will first review ordering IV fluids. A type-ahead lookup for the fluid. Use your mouse to place a check mark by the item and then select the button located in the footer. These are called order strings built by pharmacy to facilitate ordering. Select the one that most closely matches how you wish to prescribe this fluid. Click Edit if you need to make any changes to this order. IV order screens have several required fields indicated by an asterisk. The rate field, directions, and schedule. Use the drop-down box to select a rate. Continuous is used for ongoing infusions. Schedule is set to PRN, so the nurse will know to hang a new bag when the bag is empty. The next section displays the base fluid and any additives. A new rate appropriate for this patient is selected. If the rate you desire is not listed, you can type another rate, but it must be typed in the same format seen here. Then click OK. IV fluids may also be built as a bolus. Here are two examples. The first one is a weight-based dose for pediatrics. The second one is volume-based dose. Notice the schedules may be 1 or stat. The rate for this IV fluid is per protocol. This allows the nurse to adjust the infusion rate based on criteria listed in the protocol section. Notice that the protocol information is pre-formatted with parameters on how this fluid bolus should be administered. Prescribers may edit any of this information for a particular patient's needs. If there are weight-based dosing sets built for this drug, they will display first in the lookup. Dosing sets have been built to do dose calculations based on the recorded weight of a patient. By selecting this dosing set, it will do the calculations and place the order with the calculated weight-based dose without any editing. Medications or additives can be added to infusion using this area and then selecting the dose. Medications are another type of IV infusion. An example of that might be IV antibiotics. Do a type-ahead search. Use the route column to help you select the correct items. You can select more than one if you are not sure which general drug is correct. As seen here, St. Agnes does an automatic substitution of Cipro to Levaquin. Select the drug string that is most appropriate. Pharmacy has built these drugs with doses, volume, and infusion rates that are most common. In this example, you can also see that information about creatinine clearance is included. If the dose and scheduled frequency are correct for this patient, no editing is required. You can click Select. Should you need to edit the order or include other information, use the Edit button found at the end of the string. Here I have added additional information for the nurse to give this infusion through the central line. Then I'll click OK to save my edits. Clinical decision support rules and alerts are used to help providers provide the best possible care for our patients. Please read each alert carefully. In the example, the provider is alerted that dosing is only appropriate if the creatinine clearance is less than 20. Pharmacy will adjust this dose based on the patient's current creatinine clearance. We will now review medications. Using the Meds Name button to search for medications. Some medications can be given by multiple routes, for example, ibuprofen. There are two forms of ibuprofen in our system, tablets and liquid. The liquid form has an R in a light blue circle. This indicates it can be ordered by multiple routes. Clicking on the blue R will pop up a box of the routes to select, or you can select the drug and see all of the drug strengths for the multiple routes. There are two ways to edit a medication you have selected. The first one is on the fly. Click any of the green text and edit that one field, or click on the schedule and change that field. The best method when you need to only change one thing. The second way is to click on the Edit button. This will give you access to all the fields to view or change. The Complete Edit screen also allows you to specify a start date and time, as well as a stop date and time or number of doses or days. This is an example of a first dose screen. If the next scheduled dose is more than half the time span in the future, you will be asked if you would like a dose today and now. This will alert the nurse to start the medication immediately rather than wait several hours for the next scheduled time. The default is the next dose that is due. Please read this carefully. Some medications are built with no default dose but have pre-formatted dose instructions. These will always be found as the last entries for these drugs. This allows providers to use range dosing. By clicking on the field No Default, this window will pop up. Select the low and high dose by typing the dose fields. These are an example of a dose instruction attached. Range doses are only allowed if specific instructions on criteria that the nurse should use to adjust the dose. Range doses can also be entered from the full edit screen by typing the low dose, a dash, and then the high dose, no spaces. In general, if you wish to make changes to medications orders, it is best to stop the current order and enter a new order. You cannot edit the route of a medication from IV to PO. Many drugs have different dispensing dosages as well. Editing an existing order may remove important information like future stop dates. To stop a medication order, highlight the drug you wish to stop and select Stop in the footer. You may change a rate on an IV. Use your mouse to highlight the item and then select Edit. Select the rate change. Some drugs should only be ordered using drug protocol order sets. For example, warfarin, PCA, heparin, skip antibiotics. This ensures that these orders are entered in the correct format to meet existing prescribing standards. St. Agnes Healthcare would like to thank you for reviewing managing medication orders using MEDITECH Provider Order Management.